disorders are conditions that can cause changes in behavior and affect your ability to perform everyday tasks. We sat down with one physician that cares for the mental health of the Valley to learn more.
When we think about mood disorders, we're thinking about discrete mood episodes. So you can have a major depressive episode, you can have a manic episode. We tend to think of them in a little bit more of a biological sense, so abnormalities in neurotransmitters, and we tend to treat them with psychiatric medications in addition to therapy.
Mood disorders can present themselves as things like major depressive disorder.
And that can be something we call like recurrent or single episodes, so some people can struggle with it kind of off and on throughout their life.
Bipolar disorder is another mood disorder that can have psychotic symptoms.
Bipolar 1 disorder is when you have sort of a manic episode. Hypomanic episodes, on the other hand, they're a little bit more subtle, less severe than a full manic episode. Personality disorders, on the other hand, they're much more pervasive, and they're sort of a way that you move through the world.
Personality disorders fall in groups of 3 identifiable clusters. Cluster A personality disorders are characterized by eccentric thinking or behavior. Examples of this cluster include paranoid personality disorder, schizoid personality disorder, and schizotypal personality disorder. Cluster B personality disorders are characterized by dramatic, overly emotional, or unpredictable thinking or behavior. Examples of this cluster include borderline personality disorder and narcissistic personality disorder. And Cluster C personality disorders are characterized by anxious, fearful thinking or behavior. Examples of this cluster include avoidant personality disorder, dependent personality disorder, and obsessive-compulsive personality disorder as well.
That can become kind of maladaptive. I think one term that we use to describe personality disorders sometimes is that they're egosyntonic. So they're kind of in line with your own values and way of thinking.
Dr. Lilianna Yuen says being self-aware and noticing if your life and relationships are being impacted by your mental health to seek help.
I think that's the biggest thing, decreasing the stigma of mental health. A lot of these disorders have stigma associated with them. Primary care physicians are always a good place to start. A lot of primary care doctors feel pretty comfortable prescribing and managing antidepressant medications, and then they'll usually refer to a psychiatrist if they feel like there's something more nuanced or something that a psychiatrist could help the patient with a little bit more.